Well, it's 11:01. To me, it's a good time for us to start. Happy 2026 to our participants. My name's Cheryl Van Dalen Smith, Associate Dean here in the Faculty of Grad Studies. I'm so thrilled that you're interested in qualitative research, and I want to tell you a little bit about the session that we have planned for you. In fact, there's several. I'll talk to you a little bit about it today. This is an applied qualitative research series that we've established with Dr. Karen Campbell as a pan-university offering. And so it's meant to be broadly applicable, but of course there's room for questions. So this is about designing, conducting, and presenting applied qualitative research. Key word there is going to be applied, I am sure. And so over the course of the 3 webinars, we're going to be making sure that you're able to identify critical elements of research design, think about what applied qualitative research means, thinking about developing an answerable keyword there, research question, thinking about data generation, kinds of analyses, and thinking about how to present our qualitative findings. So we have Dr. Karen Campbell here. She's a colleague of mine over in the School of Nursing here at York University. Aside from being somebody that we really go to in terms of qualitative research, Dr. Campbell's program of research focuses on the intersections between women's health with physical and social geography. So cool. She has taught grad level courses in qualitative research and has designed and conducted multiple applied qualitative research projects using a broad range of study designs and approaches to analysis. So we're really thrilled, the Faculty of Grad Studies, to welcome Karen again to be providing this for our graduate scholar community. With that, I'm going to pass over to Karen and welcome and thanks again, Karen.
Thank you so much for having me. Thank you to all of you that signed up to be here today. I hope that you get something worthwhile for this out.
Excuse me, Karen. I'm sorry to interrupt you, but the interpreters, I can't give Rebecca multi-pin. So I'm wondering if Kim can make her a co-host because she can't see.
Yep, we're going to do that right now. Just give us 1 sec.
I'm sorry for interrupting.
No, please
No
do.
worries. This is
We're happy
perfect.
you did.
It's actually perfect, Janet, because I was just going to say that please feel free to put into chat any questions that come up. If there's anything that you require in terms of clarification of something that I'm speaking about, please put that into the chat. To communicate, it would actually help me a little bit if you could put in the chat just something about yourself, where you're coming from in terms of the program that you're in, the work that you might be doing. If there's something brief that you would like to share with the group, sometimes that helps me to just give a little bit more detail and try to make some of the presentation or the presentations, if you're coming to the rest of the series, to make them a little bit more practical for you. So if you would like to put something in the chat, please feel free to do that to introduce yourself to me and to others. As Cheryl said, I'm an assistant professor in the School of Nursing, and today I'm talking about applied qualitative health, qualitative research, and I come from health. And so I often say applied qualitative health research, but it's applied to the field that you're in. So if this makes sense for you, I hope that you get something from it. And at the very least, I hope that you think about or that you have opportunities to think about some of the ways in which we gather or start our qualitative research studies. I'm going to go ahead and share. Thank you for putting that all in there. That's really helpful. Oops, I'm too far forward. I'm going to share my slide deck, and I hope you can all see this. Today we're talking about designing our qualitative research. I'm going to talk a little bit about some different methods, talk a little bit about the congruence that we have, and to think about creating and crafting a research study and making sure that all of this is congruent. So just to start out, because I think that this is really important framing, and it sounds like many of you actually have quite a bit of experience in your research, but it looks like we've got a bit of, some people are really well into their program and others are starting out. So this is great. I hope you all get something. But just for those of you that are maybe newer, or for anybody really, the qualitative and quantitative research paradigms are absolutely equal. So I like to think about this as research being a sport, and we have different sports. So these two pictures that I have here are of two different sports. One is of football, one is of rugby. They are both team-based sports. They're both played on a field, and they both involve moving a ball across the net on the other side. But we don't use the same rules for these. In one of them, one of them soccer, not rugby. And in one of them, in soccer, you can't touch the ball with your hands. And in football, you absolutely can. So similarly, qualitative and quantitative research paradigms are equal, research methods are equal, but they're just different. They have different sets of rules. And so what I'm talking about today are the qualitative sets of rules. And in saying that, I also think that it's really important to know that stories and numbers are both important. This is one of my favorite articles. It's from 1995. It's still really relevant, really helpful. But Marilyn Ford Gilbo and Jackie Campbell wrote this paper about stories and numbers, and how we need numbers because they help us to understand how something's happening, but we also need the stories that go along with them to give us context about why it's happening, and particularly from different people's perspectives. And it's those stories where qualitative research helps to make sense of what we're seeing in the world. All qualitative research, I'm going to say all, but maybe you could critique me on that. But qualitative research really comes from these three big traditions. So most of you are going to be familiar with phenomenology, grounded theory, and ethnography. And these come from the big traditions of philosophy, sociology, and anthropology. And this is important because each of these qualitative research designs or methods, whichever word you'd like to use, has some philosophical underpinning to it. So in phenomenology, if you're looking to do a phenomenology study, I'm going to expect that you are looking to philosophize about something. You're thinking about the shared experience of grief. What does grief really mean to somebody? What's the lived experience of it? That is kind of where philosophy is coming from. And similarly, if you're doing an ethnography study, you really need to be grounded in anthropology and understand what that means. And if you're doing one of these studies, that's great. But I think it's really important to remember that these are really time-intensive types of studies, and they require extensive training. So yes, doing a 5-year PhD is a great time to do a grounded theory study, but we don't always have the time or space to do that. So particularly in health and other fields where things happen quite quickly, and we need to understand and deal with a problem right now, applied qualitative research seems to fit the bill on how to work around that. So this really focuses on applied knowledge. So I'm doing a research study because I want to be able to move this immediately into some sort of policy, education, practice. I want to do something about this problem right now. So I don't have 3 years to go into the field and do a deep ethnographic study because I need this time. So oftentimes producing really practical insights, it's really has an immediate practicality that you can use. It's also really flexible. So you're able to do a study in different ways, often faster and not less rigorous. So also being credible, having analyzed data that's also really transparent but useful. There's a couple of different reasons why you would do applied qualitative research. I would think that these are similar to qualitative research largely, but for applied qualitative research, you might be doing it because you need to understand something about a new phenomenon, something that's happening right now in this time and space. So something new that has come up, and I think COVID is a good example of that. There were phenomenons that came up that happened because of COVID, and we didn't have time or space to wait. We had to do something about it right away. I'm thinking of one of Cheryl's amazing students who's doing work on vaccinations, and I think that the change in how people thought about vaccinations is a good example of it. It was a new phenomenon that was, or a renewed phenomenon perhaps, that was coming up in new ways. So to understand or to explore it, to also be able to explain something, to just be able to document this from different people's experiences. And it doesn't have to be from the person that's experiencing it, but somebody that is related and knowledgeable to what's happening. And also to describe it. So sometimes we do a descriptive applied qualitative research study, and these are often ones where we talk about the barriers, the facilitators, people's perceptions and experiences. So this is another reason why we might want to do an applied qualitative research study. We always start from a space of what's the problem, and to be able to really articulate what the problem is the first step. So we want to be in that space. And does this problem need to be solved, or is it best solved by qualitative inquiry? And one of the ways in which I like to think about this is about the stem, or the beginning of your purpose statement. So if the beginning of your purpose statement has any of these types of statements, then you really are going to be well set on your way of having a qualitative research study. And this paper that I've linked, the citation here at the bottom, is in the Journal of Human Nutrition and Dietetics, and it's a really practical paper that has these types of stems. So please feel free to use these where authors are gifting us with these wonderful things. Also thinking about your research study purpose, so those stems, but also remembering that problem is going to help you to draft your question. The question is going to help you select your design, but that this is an iterative process. So as you move through this, and I'm going to say this as a researcher, that we still do this, and definitely as a student, there's going to be times where you feel like you're in an endless iterative cycle. It will eventually land into a question, as Cheryl said at the beginning, a defensible question, an answerable question is what we're looking for. I think it's really important to think about the congruence, and I'll talk a little bit more about this, but the congruence of moving from the study purpose, that you know why you're asking this question, you know what your problem is, but also that then your question can be answered, that your design is appropriate for the question that you've asked, and that the methods that you're using to find the sample and to ask the questions of the sample are appropriate. And again, that your analysis, and on the next series or the next webinar, we'll talk about a little bit more about a particular analytical strategy, but that the rules of that analysis strategy are also in line with the way that you've asked the question, the way that you've asked the participants, and the participants that you've asked. So we really want to see congruence there. And when you're working, those of you that are early on and are working on your proposals, this will be really, really key for you. I'm going to tell you about some specific applied qualitative designs. There are many. These are three that, and I'll share a little bit more at the end, but these are three that I'm thinking of. Descriptive is often used. Descriptive qualitative work is often studies that think to or look to have the barriers and the facilitators. What are the barriers and facilitators to a problem? What are the factors affecting something? So you want to be able to describe that, to be able to describe why it's happening, what the process is. And there's absolutely nothing wrong with this. This is a great study to do. It's often a good study method when you're in practice as well. So when you're not as a student and you're trying to get to the crux of a problem, this is a great way to find what are the actual factors that I'm looking at here. Oftentimes this is used in a multi-method study. So maybe you want to understand what the factors and barriers are, and then do a follow-up quantitative study to find out how often you're seeing those in your research population to help answer a research question. Another study type is case study research. And this is different than case studies. I'm rewatching ER right now. And in ER, they often, when there's a problem, when something bad has happened, they have a meeting where everybody from the medical team gets together and they look at one particular problem that they've had. So that's a case study that we often do in healthcare. This is different than case study as a research method. Case study as a research method looks at something happening within a particular context. So a couple of examples of that. One is Aaron Ziegler at TMU has done beautiful case study work about people that are getting gender affirming care from clinics in Ontario. And she looked at many different clinics. And so the context was really, what does gender affirming care look like within this within community clinics? That was the context of it, but she had multiple sites that she was looking at. Another one is interpretive description. This might be my favorite as a nurse because it really helps from a disciplinary lens to look at a problem. And here I have that it's a clinical or a health phenomenon, but in the newest version of this book from 2025, interpretive description is for anybody that has disciplinary knowledge. And what I mean by that is that nurses have a certain subculture and there's certain things that we know. So for example, I mentioned I'm watching ER. My husband hates watching it with me because I pick apart everything that they do wrong. So I'm like, no, that's not what we would do in real life. Please don't do that, because I already know that. So there's certain ways that nurses think and act. And similarly, I'm thinking about what occurred last week and over the last little bit with the ICE agents in the US. And now I'm listening to police officers or FBI agents dismantle that because they know about that from a different perspective, because they have disciplinary knowledge that I don't have. And so in doing an interpretive description study, it would be really important that you have somebody on your study team that has disciplinary knowledge that helps to shape what you're doing. Okay. The next thing that we want to do is ask a really good question. I really appreciate Susan Jack, from McMaster, who came up with this idea of crafting an EPPiC question. And what this means is that we have all of the important elements of a question. And I'm going to go through this. So EPPiC, meaning all of these, and I'm going to go through each one of these. So the emphasis is the design language. So when we ask qualitative questions, there's language that's embedded in it that gives us a sense of what type of question you're asking. So if you ask a question like, what is the basic psychological problem, or what is the process of, I already in my mind know that you're asking a grounded theory question. And this is similar for the rest of let me do the phenomenology one first. What is a lived experience? So anytime there's a lived experience, that language, it tells me that you are probably asking a descriptive phenomenological study. And similarly, what is the meaning of grief? What is the meaning of joy? What is the meaning? Those things tell me that you're looking at interpretive phenomenology. The last four are all applied designs, and this is how they would be written out. This is the type of language that you would use that would give me a sense that this is the type of question that you're asking. I'm going to just check the chat. If there's any questions that come up about this, please feel free to drop them into the chat. But I'll carry on if I can find my button. There we go. The next thing to think about is the purposeful sample. So who are the people that you need to talk to? I love this article from 2019 from Luciani, and where we wrote actually a two-part paper around how to design a qualitative health research study. I would say that this could be, again, applied outside of research, or sorry, outside of health, but just applying the same elements. So in this purposeful sample, you need to consider who are the people that you need to talk to, or what are the things that you need to gather. So you can also think about documents, about policies that might be helping you as well. So who is willing to participate, who is able to participate when we're thinking about oftentimes working with undocumented immigrants, for example. In one of our studies, we had to be very, very careful about how we involved them so that we weren't putting anybody at harm. Does the condition that people are working with, does that create any, does that complicate? I think that's a good word. Does that complicate how they can participate? And when you know that, you can also think about how do you make sure that this is safe for people, and how do you do it in a way that makes sense for your population? Are there other people that are involved with this? Are there other family members or friends? Are there other professionals that should be involved? Would an organizational view of this give you some new information that might allow you to think about this in a different way? Should any of these people be co-researchers? So should anybody on your team be involved in the research team? And we see this more and more frequently now, where we're involving people with the experience of the phenomenon, the lived experience, if you will. We're involving them directly into the research designing so that they can help us to understand better what might be the impact of the decisions that we're making. And again, I mentioned that any kind of documents, artifacts, art, books, journals, other things might be involved in your sample. So it doesn't just have to be people. The next thing to think about is the phenomenon of interest. So this is what you're interested in finding out about. What, for example, and this we did post-COVID, but thinking about the decision to wear a mask is a process. So that is one phenomenon that you might be interested in. You might be interested in the experience of an event. So a particular diagnosis that somebody might have had would be one, an educational program that somebody has gone through, or a service that you might be offering to clients. So what is the experience of the event like? There's some examples that are on there. So it could be a process, it could be an experience. It really is dependent on what you're interested in finding out. But these are all elements that you want to include in your question. The next thing is thinking about the context. Context is also interesting because we often think about geographical, so a place like Toronto or the GTA. But it could also be not just a geographical region, even rural and urban or suburban, but also thinking about a particular space like public transportation or a refugee camp. It could also be something developmental. So we've got the examples here of pregnancy, of adolescence. It can be a social time frame, and you might think about things that have happened since the Truth and Reconciliation commission report. So things that have happened, or it could be a time frame. So one of my students is working on doing a study around night shifts. So it could be something like that. The context can be whatever you need it to be, but it's important to include it in your question. And here's some examples of what EPPiC questions might look like. And I've just color coded these so that you could see what are what factors influence would be an emphasis, and what factors influence already gives me a sense that this is a qualitative description because we're talking about factors. Likewise, this could have said, what are the facilitators and barriers that influence? Oncology residents is my population. Their decision to wear a mask while speaking with newly diagnosed stage 3 breast cancer patients is the phenomenon. That's what I'm interested in. And following the end of mask mandates would be enough context, but we also know that we're doing this in Northern Italy. So we also have that context in there. And there might be other reasons for that, given that Italy had a very early on and very difficult time with COVID right at the very beginning. So the context of that might be really important. This question, I love the way in which interpretive description questions are written, because in what ways do population explain their experiences, I think is a beautiful way to ask a question, because it leaves it very open for people to tell you what they need to tell you. So we're not just thinking about facilitators or barriers, but just in what ways do they experience this? So that that language tells us that we are, and this didn't get entirely color-coded. That language tells me that we're asking an interpretive description question. Our population is right here. I think all of this in the black up until Ontario Cancer Centers would be, and this looks like it's one particular cancer center, would be how we're asking that. Here's an example of a focused ethnography question and a case study suggestion. A case study is a little bit different in that we're just asking a how question. And I know that that sounds a little bit brief, but it still gives me an idea that this is what we're talking about. The focused ethnography, we're often looking at values, beliefs, shared experiences of a particular group. So I'll expect to see that language, but I'll also expect to see that there's a particular group of people that have a shared experience that you're talking to. And I'm just going to get through these really quick, and then I'm actually going to pause and see if there's any questions before I move on. But in interpretive description, again, I mentioned that these are it's really important that we have questions that are grounded, informed by some sort of disciplinary knowledge, whatever that is. You could be a lawyer, a doctor, a dentist, any kind of practice-based work, education, as long as there's a discipline that you belong to. So oftentimes methodologists will want to use this. And if they are, so somebody that just their entire background is just how to do research. And if that is where you're coming from, you would want to make sure that somebody else on your team has disciplinary knowledge and will be part of your team doing analysis and making sense of the data. There's a range of data generation strategies that we can use here, and I'll talk about those in a moment, but really being clear about your disciplinary perspective and then getting as much information as you can from varied participants, from varied sources. Qualitative description, often very, very common because hold on, I'm just reading the question. So the question is, it can be a little hard to follow as the screen users. Okay, Yes, and I think that we can share these slides. If you reach out to Kim, I think she'll be able to share these slides with you as well. And we are going to post this afterwards. You don't need to read the information here. This is just to show you that there are articles that are qualitative descriptive articles, and that qualitative description is a space where we're looking to get a rich description. So really be very clear about what the description of this is. We're oftentimes using a purposeful sample, but one that's convenient for us, so easy to access is what I mean by that. Oftentimes, this is done through interviews, but we can also see observations in some cases, and more often interviews, sometimes documents. Oftentimes this is analyzed through content or thematic analysis. Focused ethnography is another applied qualitative research design in which we look at, again, people that have a shared culture or a shared identity, a shared experience, and we're looking at how that is integrated into life, so that we can understand that experience. It oftentimes has a limited number of participants, but also has observation. It differs from true ethnography design because we're often seeing episodic participation. So for me as a nurse, oftentimes focused ethnography in healthcare might have somebody going in to talk to nurses that are working on their night shift, but that doesn't mean that they have to go into night shifts for 6 months, which you would expect something more like that in an ethnography study, but rather to go in and out, maybe drop in on a few shifts and see with a few different people what their experiences are. Case study is also a really interesting design. It's a very applied design. Again, I think that this is a gift from Baxter and Jack from 2015 in the qualitative report. They have, it's one of the most popular studies from the qualitative report. It's a case study methodology, and it's really for novice researchers about how to, for novice case study researchers, how to plan and take from start to finish how to design your study. So it really has step-by-step guidance to help you through that. For case study, and this chart is in that article, I'm not going to go through everything on it, but for this case study, there tends to be these are the three most popular, and I would actually even say yin and steak are the most popular ways in which to do this. Yin has a philosophical underpinning of being more post-positivist. And what that means is that in this type of case study, we often see both qualitative and quantitative data that's collected. So I mentioned Erin Ziegler and her work with gender-affirming care. One of the important things that she might have done was to look at how often people that are reaching out for gender affirming care are coming back for follow-up visits. So she might have created or gotten some of the numbers around that, or how often medications or hormone replacement medications are given out. So she might have looked at some of the numbers behind that. She would also want to talk to so many people. So interviews would be oftentimes one of the key methods of data generation here. We would want to make sure that we've got lots of different variables, lots of different ways to gather some of that data. And we'd want to talk to as many people as possible. So while Erin might have talked to the nurse practitioners and the physicians that are working in those clinics that are seeing patients, she might also want to talk to the staff that are at the front desk, that are the first people that come in, that are meeting clients, that are giving gender affirming care, that are coming in for gender affirming care, to see how what's their understanding of their role in it. So being able to talk to the patients as well. So being able to talk to as many different people in that context as possible. Steak is another option for case study, Miriam as well, but less I think it's probably less cited in this group, but stake is another option for case studies, often one in which we see that there's multiple different ways of looking at something. I'm going to pause here and see if there's any questions about this while I just change a slide. So let me pause and ask you, close that. Are there any questions from anything that's come up here? And I see that Cheryl has mentioned here that it's really important to talk to your supervisor. So you get lots of information in lots of different places. And from that information, you can choose how you do that work, but you should absolutely be talking to your supervisor in terms of what the actual expectations from your supervisor are, because we all do things differently.
Karen, there is a question in the chat, maybe saying, can research include all three, descriptive, case study, interpretive, or does it depend on the paper, article versus thesis, dissertation?
It's not a silly question at all. That's a great question. It's a great question. There are three different designs, and I think that it's best to choose one design and then choose the design that is right for the question that you're asking to solve the problem that you have. So Amanda, I would say that it's important to think about, it would be important to think about what you want to get out of it. So if you only want to know, if you only want to describe, and I don't mean only, but if you want to describe what's happening in a situation, then absolutely ask that question around descriptive. Use a descriptive design. But it's going to be different if you're using an interpretive design, because if you're using an interpretive design, you want a particular outcome from it. So a descriptive, you want to be able to describe what's happening. But if you're using interpretive description, then what you want to be able to do is have an interpretive description as a method or a design. You want to be able to have some kind of clinically relevant outcomes, something that you can apply to practice, something that you can apply to a specific issue, if that makes sense. I imagine that it, like, to me, and I like analogies. So to me, I'm kind of thinking of having a room, and imagine you've got a room and there's three different design elements all going on in the same room. It just wouldn't work. Like it would look messy. And I think that this is the same thing, that case study is asking you to do a very specific thing. And if all of a sudden you're bringing in other things, it gets really messy. And so I think it's best, and this might be me being a purist in how I do my methods. I don't like mixing them. I think that you have to be very, very careful if you're going to start mixing any design. So if you're going to start mixing phenomenology and grounded theory, I think it becomes very different, because they have different philosophical places. And while applied qualitative isn't heavy in its underpinnings, it does still have different ways of doing things. Is that helpful?
Yes, thank you very much.
I'm just realizing.
Good, looks like you can carry on.
Yeah, I'm just, there we go. Okay. Excellent. Okay, so let me just see if I could share this slideshow again. Okay. Thanks. No, I just lost my Zoom, of course. There we go. Okay. Great. Are you able to see that okay, Cheryl?
Yep, looks good.
Great. I've lost it on my part, but that's okay. I'll find it again. So the information that I'm sharing in the second part comes from this paper. That's again a Susan Jack paper. And there's also alongside of this, there's a shorter element that goes, it's like a cheat sheet, if you will, that goes alongside of this. Whoops. And this really is speaking more about how you are moving forward with generation, this part of the presentation, how you're moving ahead with data generation. And I think that it's really important to continuously think about reflexivity here. So what are the biases and assumptions that you have, because we all have them? How does this help to improve our research design? And how does it enhance our credibility by being aware of who we are as researchers, as human beings? It helps us to have more ethical awareness of what's happening. It gives us some clarity around the researcher and participant relationship, and it helps to align us as human beings with the research. So there's 6 questions that we have developed around how to guide your data generation. So who's involved in data generation? And here's some considerations whenever you're making these decisions. But does the researcher have relevant experience with this? How much information will you have to share? Who can do this with you? Who are the people that you're going to engage with, not just with participants, but also with the other people that are going to help you to reach out to these participants, to help to recruit them, to help to understand what you should be asking, maybe in a different way, as well as the degree to how people will be involved. So the first question here is, what type of data will be generated? So we're looking at understanding what we need to help us answer the question that we've presented. So you want to ask yourself the data source, and to help answer this question, you want to ask yourself, are the data source and the data generation strategies the most appropriate ways to answer the research question? So are you asking the right people, and are you asking them in the right way? Is this congruent? And this goes back to Amanda's question, is this congruent with the study design? So if you're using a case study or an interpretive descriptions study, you might have more freedom in what you're doing. If you're doing a particular type of design like focused ethnography, we're going to expect that observation is involved. And if it's not, we're going to kind of question why that's happening. And so you'd have to be able to answer that question or do some observation, more likely. Does the strategy consider the participants that are involved? Are there particular tools that will help you to enhance the richness of what you're getting out? Does the tool that you're using fit with the way that you're using it? So if you're using a tool like doing something like body mapping, does that, where you're asking people to take like an outline of their body and mark on them where they might be feeling pain that day, that makes sense in a one-on-one interview. It might not make as much sense if you're doing a focus group, and it certainly would make no sense if you were doing a document review. So you want to make sure that there is some sort of alignment again, or coherence between those. Do you need any extra time with people to have time for those elicitation techniques to happen? So making sure that you have enough time. There can be many data sources. So as I've mentioned here, there might be strategies that include interviews, observations, and we'll talk a little bit more about interviews. Documents, I've mentioned drawing maps. It can also be looking at creating timelines, using videos, looking at photos. There's lots of different generation strategies that you can use. And likewise, there's lots of different data sources that you can use. And I mentioned some of these earlier as well: individuals, teams, charts or records, journals, and organization policies or documents. So just a little bit more about interviews. There's different types of interviews that you can do. And there's different types of interviews that you can do, and these range from being structured to unstructured. Oftentimes, if you're doing a qualitative description study, so a Sandalowski is usually the person that is cited for that. But if you're doing a qualitative description study, you're probably doing something that's more on the side of structured. You're asking the same questions in the same way to different participants, but it can also be unstructured and anywhere you like along that spectrum. So in unstructured, we tend not to see. In applied qualitative, we tend to live somewhere in that semi-structured range where we have an interview guide, but as somebody says something that's interesting to me, I might stop and back off and just think about that a little bit. You also want to be really thoughtful about the number of participants that you have. So you might have one-on-one interviews, and that might be really appropriate. But there may be times that it's more helpful to see somebody in a dyad. I'm doing interviews with couples after a diagnosis, a chronic health diagnosis. And so I want to know how they interact together. So I'd like to actually interview them as a pair, as a team, and look at some of that dynamic. So how they reflect on things the same. I could also do that separate if I wanted to, if I didn't care about how they interact together. Similarly with focus groups, oftentimes, sadly, they're done because it's a nice way to get a lot of data at once. It's the poorest reason to do a focus group. You want to do a focus group because you want to see the way that people are interacting together. So you want to see, when I put this group of teachers together in a room, how do they start to, how do they work? How does the dynamic work amongst them? So really thinking about the reason why you're involving the number of people that you're involving. These can also be done in a variety of different ways. They don't have to be done in person, or even through a method like this, what we're doing now, webinars or phone calls. They could even be done in text and through social media. There's different ways that you can do things. They don't even have to be done synchronously like this. They can be done asynchronously. So you send something to somebody, they send something back to you. Again, I mentioned the structure. So we tend to sit here in this applied semi-structured place. These unstructured tend to be, we'd often see phenomenology here. So just tell me about the experience of joy. And we would leave it very much like that. Really structured things, I want to know about what are the factors that were important for you attending this event today? So that would be a structured question that I would ask. So considering your interview guide, typically if we are doing interviews, we want to make sure that they're flexible, that we're asking open-ended questions, the natural flow. You are going to make sure that you pilot test interview guides. So have a friend, a family member, anybody, and your supervisor, have them sit with you and you ask the questions so that you can get a feel of what it's like to ask those questions. And all of the questions that you ask need to be asked with the space of, why does this matter and how does it help me to answer my research question? So that at the heart of why you're asking these questions needs to be to answer the research questions so that you can help give information about the problem that you've identified. So again, focus groups similarly are also going to be open-ended. You want to encourage interaction as much as possible between the members. So you want to ask really broad questions that are going to help to incite discussion, and you're really there as a facilitator of that discussion that they're having. It's helpful sometimes to have two people to do, depending on the size of your group, it's often helpful to have two people. so that one can be there to help record and to write down things that might be missed on like a video recorder or sorry, an audio recorder that you might have. It is helpful to, you don't have to, but it is helpful sometimes to see if you can find consensus as well as diversity in perspective. You want to ask prompts, to start conversation, a little bit different than interviews where you might be probing to find out more information. Here, you just want to ask a question where the group can involve. So it's not just interviews, like I mentioned, it's not just interviews and focus groups. You can do observations. You can use lots of art-informed ways of learning about your population, learning about your phenomenon of interest or documents. You can also do other methods like digital storytelling, photo elicitation. I mentioned body mapping as well as timelining. I love timelining when you're looking at how things have changed over a period of time. So since COVID, how open have we been to masks? Tell me about a time over this time. What did it look like? What did your journey look like? Have people map out what that happened. Even for my study with couples after a diagnosis, I might start to think about the timeline. So tell me about the beginning of your relationship, when the diagnosis happened, where you are now, and then what are some significant events that have happened through that. I'm not going to play this video for the interest of time, but this is one way of looking at data. This is a video of a student that went abroad and their experience of being an Ontario student in another country. Ecomaps are another method that are often used in qualitative, and this is where we identify the focus of somebody, and I'll read the small print here in case this helps, and helps if it helps for you, but we want to have the center person. So the center person in this case is Karen, who is me, and then other key relationships. So the circles around it are key relationships, and the arrows show whether I give to them, whether they give to me, or whether there's vice versa happening here. So the dashed lines, you could have dashed lines used for weak relationships, zigzags used for stressful ones, for example. But why this is interesting is that it helps you to ask questions to somebody. So particularly whenever you're working with groups that might have populations where people might be shy or not willing is the wrong word, but maybe hesitant to jump into conversation. Sometimes you can ask them to draw, and then you can ask questions about that. Oh, I've noticed that you included in your family all of these people, and then this person is way off here to the side. Tell me a little bit about why you put this over here. And you've got your work is a big part of your life. I see you've got a large circle. Tell me more about that. So it gives you space to kind of reflect and review on that. I love this idea of found poetry. Found poetry is another way of gathering data, and it's actually sometimes also used so it can be both a data generation type, but it can also be used in analysis. So it kind of straddles the line of both data generation and analysis. But found poetry is where you take somebody's words that they've shared, and earlier, one of the slides said that you can use social media. So you could use blog posts, and you could look for blog posts around how graduate students are experiencing their first year of a PhD program. You could look at a blog post and you could go through and pick out some of the poignant words. So you don't need to see the actual words here, but this was done from a transcript. And then there were particular words that were either words that seemed meaningful, something that was important, or something that comes up over and over. And then you can actually move those and put those into a poem. So you do this yourself. You do this part of actually creating that new text. And so that can be a method of data generation. Some other questions we want to ask is where will this be generated? You can do this wherever and whenever it makes sense based on the purpose. How will the data be managed? So really being thoughtful to how you will keep the data, where you will keep it, how you will protect it, and making sure that you're transparent about that with your participants. And also thinking about not just the after you have the data, but really right from the beginning, where are you putting consent forms? Where are you putting the forms where you're actually starting to put people's names and phone numbers in it, as well as during and after? How are you going to keep that safe? And I think we're coming to our last couple of questions, but how will you think about the emotional safety, both of you as the researcher? I do a lot of work in intimate partner violence, so it's helpful for me for that, but also for your participants. Oftentimes, qualitative research is thinking about some tough questions. We're often really getting deeply into the heart of something, less so with the qualitative description, but oftentimes with some of the other methods that we're using or designs. So my key message to you in ending this part about thinking about the data generation or your plan, really consider who, what, where, when, and how you're asking this is going to help to think about what is the right data generation source for you, and is it congruent with what you're doing? Consider again the emotional safety of you as well. And my thanks to my colleagues and friends, Dr. Carly Whitmore, Elizabeth Orr, Erica Vassie, and Susan Jack, who also helped with these presentations. This link here is to an information sheet, and this information sheet also is a short form of the data generation strategies. So if you click on that, just leave it open for a minute, or if you, screenshot that, you'll get access to that, and I can share that with Kim if anybody's interested in it.